several targets and very ambitious goals, which have been severely set back in the last 2 years. We have less than a year to reach some of those targets, which were benchmarked to be achieved by the end of 2022. And global efforts, despite our best attempts to save millions of lives, have fallen somewhat short. The pandemic has paired with several other crises to affect the work that we are doing in a negative way. And so there is a dramatic need for us to step up efforts and investments to bridge the gap in the fight against TB. The aim of today's meeting is threefold. First, to review progress we have made on global and national targets. Second, to discuss approaches for sufficient and sustainable financing. You will recall there were ambitious targets in the 2018 declaration for financing research and development. And third, to highlight strategies that can accelerate such research and innovation of new tools, including effective TB vaccines and leveraging lessons learned, because there are many out there that we can share, particularly in relation to the COVID-19 pandemic. This event will also serve as a very, very valuable platform for us as we launch into the momentum for the next high-level meeting on tuberculosis, which is in 2023 during the General Assembly. We will have 3 sessions, an opening segment, and then there will be a ministerial level panel discussion, and then the third segment will be panel discussion from among partners, because without partners we cannot achieve the goals we have set for TB. We have a very distinguished lineup of speakers with several ministers to whom we are very grateful, and senior government representatives and champions from civil society that have long been with us in the fight against tuberculosis. So if there is time, we will gladly have questions and answers at the end, which we hope we will. Let me first now, without further ado, address Dr. Tedros, who is our Director General in WHO. Thank you, Dr. Tedros, for your commitment to ending TB as part of the efforts to reach universal health coverage.
Thank you, Governor. Your Excellency, Minister Budi, Honorable Ministers, distinguished delegates, dear colleagues and friends. I thank my friend Minister Budi and the government of Indonesia for your leadership on health and for prioritizing TB as part of your G20 presidency. Terima kasih. Tuberculosis remains one of the world's leading infectious killers. Despite being a preventable, treatable, and curable disease, this ancient scourge kills more than 1.5 million people each year and affects millions more. The impacts on families, communities, health systems, and economies are enormous. Let me remind you that in the Sustainable Development Goals, all countries have committed to ending the TB epidemic by 2030. This is no small ambition, but the gains we have made in recent years gives us hope that together we can achieve it. In the last 2 decades, more than 66 million people have received access to TB services. Deaths from TB have dropped by around 40% since 2000. But these hard-won gains are at risk, as we all know. The COVID-19 pandemic has set us back, disrupting essential services to prevent, detect, and treat TB in many countries. As a result, WHO has reported an increase in TB deaths for the first time in more than a decade, and that's very tragic. Conflicts in Afghanistan, Ethiopia, Syria, Ukraine, and Yemen are further jeopardizing access to services for people with TB. To get back on track to meet the TB targets of the SDGs and WHO's End TB strategy, we need strong leadership in high-burden countries and from the international community. I would like to emphasize 3 priorities for action. First, we urge countries to intensify efforts to restore essential life-saving TB services that have been disrupted. Rapid uptake of the latest WHO policies on TB prevention and care can significantly improve outcomes of those affected. This is the only way to end preventable TB deaths. As COVID-19 and TB have similar symptoms, we need wide testing for both diseases so that people can get the treatment they need. Second, we need to urgently scale up investments to increase access to services for TB prevention and care to accelerate progress towards the 2022 targets, because lives depend upon it. Today, less than half of $13 billion annual funding needs are met. Even though we know that investing in ending TB is highly cost-effective. Again, I thank Indonesia for highlighting this shortfall as part of its G20 presidency. Increasing domestic public financing is the most sustainable way of closing this gap as part of every country's journey towards universal health coverage. At the same time, countries with weaker economies have inadequate fiscal capacity to expand public financing, especially following the enormous socio-economic impact of COVID-19. These countries will need additional external support in the short and medium term. We must also remember that progress in public health depends on innovation. Financing for TB research must at least double to successfully drive discovery of new tools, including vaccines. To intensify vaccine development and building on lessons from the pandemic, WHO plans to convene a high-level summit early next year. This will support the rollout of the global strategy for TB research and innovation endorsed by our member states. And third, we urge all countries to integrate services for TB into primary health care as part of their journey towards universal health coverage. The struggle to end TB is not just a struggle against a single disease. In many ways, TB is a symptom of how our societies have failed marginalized communities. It's also the struggle to end poverty, inequity, unsafe housing, discrimination, and stigma. Ending TB is not a job for the Ministry of Health alone, as a result of all the things I have outlined. We need action and greater accountability from countries, partners, and civil society across all sectors to end TB. A year from now, we will meet again for the second high-level meeting on TB to take stock of progress and to re-energize commitments to end TB. In the coming months, WHO will work with the offices of the Secretary General and the President of the General Assembly to prepare for that meeting. If the pandemic has taught us anything, it's that with solidarity, determination, innovation, and the equitable use of tools, we can overcome severe health threats. Let's apply those lessons to tuberculosis. It's time to put a stop to the long-time killer. Working together, we can end TB. I thank you.
Thank you very much, Dr. I would now like to invite the Honorable Health Minister of Indonesia, Dr. Budi Gunadi Sadikin, to deliver the next opening address. As you may know, Indonesia holds the G20 presidency, and they have placed a spotlight this year on ending TB, building on the outcomes of the G20 Health Working Group and its call to action on financing the TB response. I'm sure you will tell us more about that. Minister, please.
Dr. Tedros, ladies and gentlemen, I just realized standing here in this wonderful building is my 1 year and 9 months as health minister. I came as a health minister during the worst time. I can after 30 years as director. And I've seen many bad and ugly times. I've seen the worst pandemic. I've seen many Indonesians, going to hospital, looking for oxygen, dying. Even as a health minister, couldn't help my friends and family, bringing them to hospital or getting oxygen. It's a very dreadful experience, even as a health minister. And after that, also I realized I learned a lot about health. And I realized that this tuberculosis has been with us for 140 years and still impacted more than 10 million people every year and kills more than 4,000 people a day. And Indonesia ranked between number 2 and number 3 globally. I also realized that it kills more people than COVID in Indonesia until now, cumulatively. So it is a very bad disease for Indonesia. I just also back from Global Fund replenishment. HIV, malaria, tuberculosis. So I also realized that this tuberculosis is a poor people and poor country disease. So as a representative from poor country, Indonesia is still categorized as lower middle income country. I can feel that. Why tuberculosis has been there for many years, 140 years after discovery of this. But ladies and gentlemen, all of those dark sides, there'll always be a bright side. As a 30 years bankers, I've seen many global financial crises. And for every major crisis, there are always major opportunities. Only through great earthquakes, rocky mountain crisis. So this major pandemic, global health crisis, open up opportunities also for major islands. Let me share the numbers, Indonesian numbers. Since I joined in December 24, 2020, 1 day before Christmas and 7 days before the first peak of Alpha variant in Indonesia, we have tested 64 million PCR or molecular tests. We have got 6.4 million positive COVID-19. We have vaccinated 204 million people, and we have vaccinated 438 million doses. And you know that the COVID-19 vaccine has been rolled out in less than 2 years. That were the bright side of how technology for infectious diseases happens. As a non-health professional, when I see this, then my question is, why these good things did not happen with TB? That is my question. Because when I see this, it is quite amazing. TB in Indonesia is only 834,000, and we just have our 77 years anniversary. So if we can do test 64 million in 1 year and 3 months, why can't we do testing and found 6.4 million people infected? Why couldn't we found 834,000 in 77 years?
Yes, that's the skill.
We should.
Yes, that's the skill.
And then I realized that the problem is only with one word, is commitment. Whether we are committed as a leaders, whether we are committed to put enough resources, attentions, budget to do it. So I talked to my friend, I talked to the president, if we want to end TB by 2030, then we really have to commit ourselves on doing it. So let me share with you what is our plan, at least in Indonesia. First, I changed the target. So I said, I only have 3 years and 9 months as a minister because I'm replacing someone before me. And I spent already 1 year and 3 months, do this vaccination and, overcoming the pandemic. So I only have 2 years and 6 months left. So I'm very calculated on everything. And I can be very brutal as an ex-CEO of the largest bank in the country and giving target. I only have 30 months. So in 30 months, I said to my people, I want you to identify at least 90% of those 824,000. It's not millions, it's only thousands. If you cannot, then I will use the brutal force as an ex-CEO of the bank. Bankers are very brutal person. As I said to Peter said, would you help me raise 18 billion funds? Peter, you know and I know, as a 30 years bankers, maybe each of us has raised $1 trillion for our client. So 18 billion is nothing in terms of money, because we have raised trillions of US dollars. But Peter, in terms of amount, it's a huge amount. But in terms of value, we feel it is so small value to humanity. This 18 billion global fund raised for tuberculosis, HIV, and malaria, for us bankers, is small. But in terms of value to humanity, I feel is the biggest value that I can contribute to humanity. And I think you should agree with that. So congratulations for global Wasting so much money for something, that is not good for humanity and moving health. I wish I worked in health for 19 years instead of 1 year. So that is what we will. We will increase our surveillance. We have 10,000 puskesmas, primary health workers, and 300,000 community workers across the country. We will standardize and push the surveillance mechanism. We learned that India has a cheaper methodology how to do it. I asked the team from Stop TB Partnership, can we contact India to reduce the price by one-half to do it? We will do whatever we can. We will allocate budget to do it. We can help from Global Fund to get increased money, how to do it. And we'll allocate also a national budget to complete the surveillance. I want to get 824,000 done. And I just realized that we can reduce our testing from COVID from before is around $100 when we start testing PCR test for COVID to $10 in 12 months. So we should be able also to do that for tuberculosis testing. Now it's around 20 to 30 US dollar. We should be able to reduce it to $10 and $5, and that it will become very, very fast. In PCR testing for COVID, we start with only like 50 labs, PCR labs. Now in 6 months, we can accelerate to 1,000 labs across the country. And I realized that this PCR technology, I'm not a technologist by myself, but this PCR molecular testing is very, very similar with whatever we do in tuberculosis. So if we have 1,000 labs across the 17,000 island Indonesia that can do PCR testing, it should be able, with some slight changes in technology that we can do also testing. So that is on the surveillance side. On the vaccine, Dr. Tedros mentioned to me, Budi, we need to do also something with vaccine. Vaccine in COVID-19, unprecedented, 22 months, a lot of vaccine. So I said to Peter, even 18 billion, why don't you spend some of them, to develop a new vaccine? And then I approached many other global institutions. We had dinner yesterday, and Bill Gates was there. I talked to Bill. Bill, I know that, I talked to Jeremy Feather, Wellcome Trust, found there is one entity that successfully found a good candidate for tuberculosis vaccine, but they don't have enough money, so they transfer it to Bill and Melinda Gates Foundation. Now Bill and Melinda Gates Foundation will push this, and they're looking for a country to do clinical trial 3. I said, I will be participating. So I will be participating as an international locations to do the clinical trial phase 3 for this tuberculosis vaccine. Because I have the population, and I can contribute also some funding. And I have also researchers and vaccine manufacturer, AQ, WHO, Dr. Tedros knows that can help. And hopefully that will start also, and the next generation of tuberculosis vaccine will be available very soon. In G20, we are talking about the new research and manufacturing hubs for mRNA technology. So this is the future technology of vaccine. We just have the SAPI board meeting in Bali last week, and SAPI is very, very committed to establish an mRNA technology in global south countries so we can develop the next generation of vaccine less than 100 days. So if this is available and the team is already working on this, hopefully then the next generation of vaccine based on mRNA technology will be spread over the world and will be able to produce vaccine faster than what we are seeing before. So a lot of initiatives are moving in the right directions. In closing the speech, I would like to remind us that in 2018, the United Nations General Assembly actually has an unprecedented political commitment to ending tuberculosis in 2030. And next year, in 2023, we have a 5 years review window to ensure that political commitment remains as strong as they are. And Indonesia is very committed that we will co-facilitate as the representative of the lower and middle income country that have a lot of tuberculosis patients, and a country that is committed, to accelerate, to end TB by 20. And today I would like also to pay tribute to all of you, experts, practitioners, policymakers, business leaders, community workers, for your continuous support and unwavering commitment to make the world free of TB by 2030. And remember about global commitment. This morning, I'm a Muslim, so I cannot eat bacon and egg. But I always say, bacon and egg is a good example between commitment and involvement. Because to be available on your table. The chicken is involved. So for you to eat the egg, the chicken are involved. But for you to eat the bacon, then the pig has to be committed.
Thank you very much, Minister. I think you have shown us now what we have missed since 2018, because we had political commitment, we had the health sector, civil society, but we missed the banking sector. Now that you are on board, I hope, and I think all of us do. The last speaker to round out the opening is someone from civil society. Her name is Jackie Quinn. She is a TB survivor and an advocate from We Are TB. Many of people that have been through the disease and are currently still in treatment. Please, Jackie, can you bring us your perspectives?
Hi everyone. My name is Jacqueline Quinn. I'm a TB peer support navigator with VRTB, an advocacy group, an advocacy support group for those who have been impacted by tuberculosis. I was diagnosed with active pulmonary TB on February 12, 2019. And I'd like to point out that I use the word survivor very reluctantly because it's my personal belief that over a century later, nobody should be forced to succumb to the fatalities of TB. Tuberculosis is a disease that, for some of us, is very complex to understand. It is a disease that's not easily spread until it is, and like many others, it can mask itself as a harmless seasonal sickness. But unlike as many, it can sleep in your body for a lifetime without ever manifesting itself. And how can one demand patients to go through such a tough and long treatment when said patients may never attain the peace of mind that comes with a negative tuberculosis test? And that's how my story begins, with sheer ignorance. Growing up in a city in Mexico that is widely, where tuberculosis is widely prevalent, I never imagined that what felt like a simple, prolonged cough would turn out to be a deadly disease that would change my life forever. I asked, tuberculosis? Isn't that a disease of the past? One that causes people to cough up and vanish, shortly thereafter? A disease that you only test for when your work requires interaction with the elderly or impoverished communities? Weirdly enough, my first thought was not that I was going to die. I figured if I hadn't heard about that ever happening to anyone, then it probably meant that it was rare. And people who get a positive skin test usually claim that it's because of the vaccine. So I was certain that my doctors in San Diego would know how to handle such an old disease. So I wasn't particularly worried about TB posing a threat to my life, but I was definitely worried that that it would compromise my professional career, that it would end it before it began. I had hopes of becoming a dentist, and again, I was afraid that this diagnosis was going to compromise that outcome. I suppose I was fortunate enough to be ignorant, because had my internet search yielded all the information that I now know about TB, it would have imposed a lot more stress than had already built up by then. Unfortunately, my TB journey saw ignorance in more than one instance. The diagnosis was not exactly intuitive to my attending clinicians. I went from being misdiagnosed with pneumonia to getting locked at the emergency room for seeking a second opinion when I was already told I had pneumonia, to a diagnosis of valley fever, which is a disease caused by a fungus. So 3 weeks and multiple new symptoms later, I opened several alarming voicemails while taking a lunch break at work. And it turned out that my culture for Mycobacterium tuberculosis had grown, which meant that I had to follow a strict set of rules in the following days. One of those rules meant that I had to set up a follow-up appointment with my pulmonologist. And lucky me, they were able to book an appointment for about 6 days after that call. And I thought, I've been waiting this long, and now I have to wait another week to potentially get a prescription. So not a chance, no. And not with the support system that I had. So then I had to advocate for myself, get another set of analyses, and get a hospital referral, which turned into a 3-week stay at the hospital and a 10-month-long treatment. But how did I have the energy to stand up for myself for so long, to so many people, and while feeling sick and weak at the same time? Like I said, it was my support system. So I'm fortunate enough to have very close family members who happen to be physicians in Tijuana, Mexico. That's my hometown. And they actually kept tuberculosis on their radar from the moment they heard me cough that winter. The wait for me to receive care got so frustrating that I considered seeking care in Mexico. But the main reason I didn't follow through with that was because it meant that I had to seek hospitalization in Mexico, which unfortunately meant that I was less likely to encounter the latest TB treatment that may be available elsewhere, probably in the United States. So my circumstances got me thinking about how some areas of the world are richer in knowledge while others are richer in resources. This disconnect is unproductive all around. And I can honestly say that I lived my worst day yet during the early stages of treatment. And yet I personally consider my story to be the best case scenario. Sadly, misdiagnosis has become almost a staple in each of my peers' stories, and quite frankly, I think it's unacceptable. This is what encouraged me to join We Are TB. Through this group, I've worked with numerous people across the globe who are also struggling against the disease or its aftermath. They all have different backgrounds and unique stories, and they provided me with a perspective I never thought I would gain. I'm proud to call these people my peers, and as I mentioned earlier, my support system is what got me through the dark times that more often than not accompany a positive TB diagnosis. So I would like to offer the support system to others and help empower them to become advocates for themselves or anybody else in need. So I would like to ask for your urgent action on 3 fronts. Prioritization of ending TB in the global health agenda across all countries, those with a heavy burden and those without. As TB can strike everywhere and anyone, essential prevention, diagnosis, and care must be available for all as we look towards a universal health coverage. We need shorter treatment. New shorter regimens without any injectables and rapid tests should be available to everyone everywhere upon diagnosis. We need new research and development. COVID vaccines were developed unbelievably quickly, as it's already been pointed out. So why are we still using a vaccine that is not that effective 100 years in? Like most of you in this room, I too refuse to give up the fight against tuberculosis, and I hope that my story helps shine a light on the urgency to take action, because TB anywhere is TB everywhere. Thank you.
Thank you very much, Jackie. I'm now going to ask my colleague Monica Diaz to moderate the rest of the discussion. The first segment will be a ministerial panel, and then that will be followed by civil society stakeholder discussion. Please excuse Dr. Tedros, who needs to move on to his next appointment. Thank you very much for coming, Doctor. I believe the minister may stay a little longer, or if he doesn't, we are also very happy that you graced us with your presence. Monica has promised to be a much stricter moderator than I am, so she's next in line.
Thanks so much, Verna.
and greetings, colleagues. I'm Monica Diaz from the World Health Organization Global Tuberculosis Program, and I'm very pleased to moderate this high-level ministerial and global leader panel. So we have a great lineup for discussion. We have with us the Honorable Ministers of South Africa and Malawi, the Ambassador for Global Health from France, the Assistant Secretary for Global Affairs, Department of Health and Human Services from the United States of America, and the Assistant Minister for Global Health and Welfare from Japan. I'd like to invite you to please come and take the stage, honorable ministers and other high-level representatives. So Honorable Dr. Makume Joseph Fala, if you could please come join us. Honorable Dr. Kumbise Chibunda, Her Excellency Ms. Stephanie Sedu, Ms. Lois Space, and Mr. Eiji Hinoshita. May we please invite you to take the podium, please. Please come have a seat. So we're very happy to have this distinguished panel with us. We've already heard from the Honorable Minister of Indonesia, who is the co-host of the event, perspectives from the country, and here we have a much broader panel with us. The focus of this panel discussion is going to be on sharing of progress towards achieving the 2022 high-level meeting targets committed by heads of state at the 2018 UN high-level meeting on TB, especially in the context of the COVID-19 pandemic that has reversed progress. Key actions taken to strengthen and build multisectoral engagement and accountability to NTB, and the perspectives of countries looking ahead to the 2023 UN high-level meeting that will bring together heads of state again to spotlight ending TB. So to start with, I'd like to first invite the Honorable Minister of Health of South Africa, Dr. Makume Joseph Fala. South Africa is a leader in rolling out innovations to end TB, from rapid diagnostics to new drugs to preventive therapy. They are leaders in research and are part of the BRICS TB Research Network. South Africa actually in 2018 was instrumental in pushing for the first UN high-level meeting. So I'm very pleased to invite Honorable Dr. Fala, Minister of Health of South Africa, to deliver his statement. The floor is yours.
Thank you very much. I hope this is on. Okay. Thank you very much, moderator, for this event. Good afternoon to our host minister of Indonesia, Mr. Budi, in his absence, and also to the DG. We are indeed very pleased to come and share a few thoughts with this distinguished guest. Greetings to my colleagues, panelists, ministers. Also, so my colleague is there on the table, Minister of Ethiopia. On the 24th of September last year, His Excellency Abdullah Shahid, the President of the 76th session of the UN General Assembly, reminded us about the political declaration which committed countries to ending TB by 2030. The goal of the declaration was to ensure that 40 million people had access to diagnosis and treatment by this year. Now, at that time, no one would have anticipated the advent of COVID-19, which has caused a lot of disruption to all our programs. It has caused a detour. Hopefully, it's just a detour and we can be able to recover. This disruption meant that in many of our countries, and we are one of those, few people were tested for TB, and few of those who tested, especially during the hard lockdown, were actually linked to treatment and care. And we even also lost a lot of people who are already on treatment to follow up, so the defaulter rate increased. The reality of the situation is that as the result of the COVID-19, a lot of resources were put into fighting COVID because it was such a high pressure, where unlike TB, where it takes quite some time before people get seriously ill. With COVID as a pressure where people got seriously ill within days and even succumbed, we put a lot of our resources, financial, physical, human resources into tracing, in terms of putting our community health workers and all other resources into fighting the pandemic. And in the process, the declaration which we have committed to on managing tuberculosis, controlling the spread of TB, and making sure that we can reduce its impact and eradicate it by 2030, definitely did suffer. Indeed, this has been a major crisis, and we hope that this is hopefully behind us. We know COVID is still in our midst, but we hope the acute phase, it doesn't come back. Now, when the restrictions eased, we realized that we had fallen behind quite a lot in our targets. Hence, we developed a plan for continuity of essential services, while at the same time still dealing with the pandemic, continue with vaccination. Now, this was one of the measures that were taken to continue to make sure that we can manage the pandemic while also catching up with the lost ground as far as TB and other diseases are concerned. Coming back to TB, in our country, we have recorded the TB incidents having reduced from around 450,000 in 2015 to just around 330 by 2020. But not all those were on treatment. Those were diagnosed, and not all were diagnosed, and not all were put on treatment. So our treatment target was still short of even the 90%, and less in terms of sustaining the treatment. So now this was obviously made worse by the pandemic. So as a result of that, we had to take practical steps to accelerate our performance in line with the political declaration of 2018 of our heads of states. So as a country, we have then developed a TB recovery plan, which is a national plan to address all these detours in our services, or also the failure to track and trace those who were not picked up during the pandemic, acknowledging that even during the pandemic, we still have a shortfall. We have decided that as we reset and recover our systems, we need to pay special attention, not to all the areas, including non-communicable disease, but specifically to TB, that it must be integrated into our recovery and also a focused plan for recovery on TB. This plan is also the foundation on which we are developing a new national strategic plan for HIV, STIs, and also TB, which we will be launching right now at the end of our current strategic plan, and we'll launch a new strategic plan at the beginning of next year. So as a country, we've also just come back just over a few days ago. I closed the TB, we had a national TB conference, which I closed on the afternoon of Friday last week on the 16th. This conference was attended by various stakeholders from local authorities, provincial authorities, and national government, and also private sector and civil society. So also TB managers at the district level, at the regional, and also at the national level. This was to recommit the whole of society towards this national recovery plan. So it's going to be beneficial. We've felt it was beneficial that all our sectors should pull together in implementing the National Recovery Plan. We want to also mobilize other role players within the private sector. Also in our country, we also have traditional leaders to make sure that we mobilize them, faith-based leaders, and as I said, civil society and business. So these are all the sectors which we want to make sure that we will be working together in implementing our National Recovery Plan. So we want to assure all our colleagues gathered here today that as a country, as a government, and as all of government and society, we are going to pull all stops to make sure that we can get back on track in implementing the 2018 commitments. Thank you.
Thank you, Honorable Minister, for your strong commitment towards ending TB and for all the key actions that the country has taken to get back on track. It's really impressive and inspiring. Thank you. I'd now like to turn to Honorable Dr. Kumize Shibunda, Minister of Health, Malawi. We are very pleased to have you with us here today. While not among the top 30 high-burden countries, TB remains a public health problem, continues to remain in Malawi, and the country is really advancing efforts to combat this disease. We are very appreciative and we look to you for your statement, Honorable Minister. The floor is yours.
Thank you so much, Madam Moderator. I'm honored to be here to share Malawi's journey in the fight against tuberculosis over the years. The last 10 years, the estimated incidence of tuberculosis in our country was about 350 per every 100,000 mark. 7 years ago, which is 2015, the incidence was about 197 people per 100,000, while mortality was about 68 per 100,000. A lot has happened. We have achieved a lot in the last, let's say, 7 years to be where we are. As I'm talking to you from the data from 2020, our incidence is about 131 per 100,000. And we are targeting that at least by the end of this year, we should be around 100 people per 100,000. Now, in terms of mortality, like I said, 10 years ago, we were about 68. But by the year 2020, we were about 36 people per 100,000. I know 36, it seems that we have really come from far. But 36, that is a number too many. We're talking about our people, we're talking about our women, we're talking about our men, we're talking about those who have been productive citizens of the country. So that is why, as a country, we are very much committed that indeed, as already said by the DG and also the Minister of Indonesia, that all of us, we need to hold hands in order that we end TB by the year 2030. But we are counting. 2030 is only 8 years from now. This is 2022. So if we are saying we, from last 10 years, incidence was at 350, now we have come to about 131 in the last 10 years. Yet we only have 8 years before 2030. It means we have to do much, much more than what we have done in the last 10 years. Because we could not achieve to at least have or just get to a quarter of what it was there. So it means we need to do a lot. Now, in terms of testing, we do a lot of testing, but we have also intensified, especially in the tuberculosis affecting children. Between the year 2018 to 2023, we had about 6,497 children who were diagnosed and also treated with TB. The biggest challenge in our country has been infrastructure, especially in the rural areas. We lack infrastructure. 60% of our people, they live in the rural areas. And that is a lot. And some of them, they have to walk up to now 10, 15 kilometers just to have an access. You can imagine somebody who's already sick, who's already weak, to walk all those kilometers. So as government, apart from the physical infrastructures like health facilities, we have also introduced mobile testing. We have about 10 vans which have been fitted with laboratory services equipment, including for PCR testing as well for TB. At least we are using those in the hard-to-reach areas. But we have also included the stool-based expert for testing, especially in the children, apart from the X-ray services. Another issue which I think it is important to bring it out, it is about the drug resistance, which is happening amidst our community. From the year 2020, we had about 550 drug-resistant cases which were identified and treated. So you can imagine 550 are those who maybe for some other reason they find themselves in our facilities. It means that there are so much more in our communities, but they might not even be aware. So it means we really need to do something, especially in the testing of drug sensitivity, but also in finding cases of those who could also be facing drug resistance. And also to appeal to our service providers, especially the manufacturers, to do more, especially coming up with drugs which would be more sensitive than the ones which we are using at the moment. In terms of TB preventive, we are making it available, especially for those who are living with HIV/AIDS. As I'm talking now, we have about 210,000 people who are also receiving TB preventive treatment of those who are living with HIV/AIDS. So lastly, I just want to say thank you for this interaction. I'm happy that the people from different sectors here, like I said, we have mentioned challenges. It is very important. The issues of infrastructure, we cannot just isolate the disease itself. Because to manage it, we need infrastructure. To manage that patient, we need human resource as well. Honorable Minister has already said how we are affected during COVID. Because most of the staff which we had, they had attended to COVID patients. And COVID being as infectious as it was, we could not afford to also have them treat the other cases. So when we are looking at these issues, I would want that we look at how best we manage it. We need infrastructure, we need human resources, and of course we need the drugs for the same. And of course we also need modern diagnostic procedures, equipment for our people. Thank you so much.
Honorable Minister, thank you so much. Indeed, very practical, comprehensive overview of everything that's needed across the spectrum, putting the patient at the heart of the response and also looking at the co-epidemics that exist. So thank you so much for your intervention. We are now pleased to have with us Her Excellency Ms. Stephanie Seydoux, French Ambassador for Global Health, France. France has been prioritizing global health, especially in the fight against infectious diseases, reinforcing the multilateral approach to global health issues via strengthening of the World Health Organization and supporting an equitable response to the COVID-19 pandemic. And also we are very appreciative of the WHO Academy established with your support in Lyon. So thank you for all of the support, and we look forward to hearing from France. The floor is yours, Your Excellency.
Thank you. Thank you very much. Excellencies, Minister, Michael panelists, ladies and gentlemen, it is so urgent that we put our heads together and gather the right kind of mobilization against tuberculosis on the eve of a major event, which is the replenishment of the Global Fund happening tomorrow. I am energized by the testimonies which we've had from yourselves, ministers, as well as the Minister of Indonesia, and you show indeed what political commitment as well as expertise how that can make a difference. The commitment is key. Indeed, thank you for the introduction. France remains a very strong supporter of TB efforts worldwide, essentially through our contribution to the Global Fund. Been the second donor historically since the beginning of the Global Fund, with a contribution of, well, it's in euros, it's less, I'll say it in dollars, it's over $6 billion since the beginning. We are also an active board member, and we were very pleased that the board discussions this year prior to the replenishment led to an increase of the share of Global Fund financing, which will be devoted to tuberculosis. It's probably not enough, and there was an absolute emergency to do so, but it is the way to go. I'm very pleased also to be a board member of Stop TB, which does the go-to technical partner does such amazing work, and very happy to share the seat with a very committed partner, Japan, from Japan later. So the COVID pandemic obviously turned everything upside down, set us back in a way which is absolutely tragic. In the midst of the pandemic, we were happy to hold in France and Toulouse the vaccine summit, which delivered very promising and exciting possibilities from researchers all over the world, quite a few from European, and we also, of course, it was a virtual conference, which was unfortunate due to COVID, but COVID also lent new urgency to our discussions, because we saw what could be done, as we were reminded by a previous speaker, in terms precisely of a world pandemic. We must do the same for the next tuberculosis vaccine, clearly. The challenge will still be equitable access. I'm not going to say, not as well as you did, Minister, how important primary health care is, but it's all linked, and one of the challenges we have is definitely going to be equitable access. For this, I want to commend the work that we do with UNITAID, amazing agency that does research, development and innovation, and they are in the room. You can talk the executive director here, maybe we can give a few examples later, but definitely developing the pilot project, the prototypes, which show how innovations can be brought to the people testing the model of care, as well as the solidity, let's say, of the medical, biomedical response. So that's a very promising formula, and definitely France will remain committed to supporting UNITAID, which is key and vital in what the Global Fund can do in the future, in the next 3 years in particular. Also, of course, WHO, it is key. The Director General gave us the timetable. The key high-level events under his leadership, with gathering everyone in the room, are absolutely key, and it is the best thing that can happen, that we can have this, that we can have the high-level summit again in 2023 in a year's time. And like you said, Minister, time is of the essence. Only 8 years to go, and in some ways this helps. I mean, we can actually have a countdown to the next 7 years. We must start it now. You have started it in your respective countries, and I believe that this is something that collectively we could definitely find support in. So it's very timely that we're having this event next year. And I would like to finish my intervention by pointing also that France has been active supporting a global fund mechanism, an initiative which is put forward by Expertise France, our technical partner agency. And just to give you a flavor, and I'm sure that they can develop that much better than I can, but focusing exactly on what you say, Minister, which is the model of care and the very concrete ways in which pilot projects can make a difference in country. For instance, there's been a multi-country program, TB Speed, which is also supported by UNITAID, which helps enhance the diagnostics among children, so that there isn't the situation which the young lady who testified so well earlier said, that so that the diagnostics do not that are effective, and that no TB cases fall through the cracks. And this is done with children with acute pneumonia. This project has showed efficiency with new testing methods. Also projects in Côte d'Ivoire, for instance, in Abidjan, in secondary cities as well. And this is an outreach specifically to drug users, and it works. Community health works, peer-to-peer operations work, and including TB local clinics as well, which is a key aspect. So I'm going to stop here and say, tomorrow we need to really get the 18 billion, which will help end TB. France will remain committed. Thank you very much.
Thank you, Ambassador, for your strong commitment as well, and your powerful words, and the support from France. Yes, we do look forward to very successful replenishment with everyone's support. I'd now like to turn to Ms. Lois Pace, Assistant Secretary for Global Affairs, Department of Health and Human Services from the United States of America. The US government is the biggest bilateral funder of efforts to end tuberculosis worldwide, and we are extremely appreciative for the support from the US government, especially through the US Agency for International Development, USAID. We've been working closely, and TB has received support for decades with USAID support, and we're especially grateful for your leadership in efforts to ending TB and support in countries and globally. Ms. Pace, the floor is yours.
Well, thank you for that gracious introduction, and thank you also for this wonderfully loud microphone with my mask on. I am just going to do my best to follow all who came before me, of course, with warm regards to DG Tedros and Minister Budi in their absence. Their leadership has really been special, not just for TB, but across global health, and of course, acknowledging the honorable ministers here of South Africa and Malawi. Thank you for your interventions. My fellow panelists, of course, I always enjoyed partnering with you both, as well as with others around the room who are represented, including civil society. And I just want to thank Jackie as well, you for telling your story and for grounding us in a real experience. And as you said, I can appreciate your comment about survivorship and the fact that you shouldn't have to be a survivor, although we are very glad that you're here so that we can end this fight once and for all. So I will, gosh, Stephanie, you stole all my thunder, but Ambassador said you said it so well. We really need to come together around this issue where we're obviously in an important moment now with the Global Fund replenishment upon us. We in the U.S. are very proud and happy to be hosting this year's replenishment, and I know we'll hear more from the Global Fund's leadership a little bit later. But look, we are all about finishing this fight, and it is about finishing the fight across the three diseases. As Ambassador Sidhu said, we have some really important conversations as a Global Fund board about how TB fits into the mix and the fact that it has been left behind, and we have to do more to ensure we continue to lift that up and track its progress or address it when we are falling behind. And so rest assured, know that this is something to which the U.S. has been committed, as you said, with our partners at USAID, but across U.S. government, and will continue to be committed. Just as an example, and because I'm here representing the Department of Health, I'll pull from our department as well. I think people are well aware also of the work of the CDC, and I know I have a representative not just from USAID, but also CDC here, so please find them later. But I know our CDC is in particular working or leveraging the PEPFAR program to identify these cases of TB so that we can diagnose them and that we can put people on treatment. And I think that is going to continue to be important, obviously, as heard, but something to which I know our CDC and USAID agencies are going to be committed on the ground. We can't forget, though, the research agenda, and I'm really glad that Dr. Tedros talked about this as well. So our National Institutes of Health has been a really major funder of TB research, and I think the U.S. overall has put a lot into the space. I think by some accounts we make up close to half of global investments in TB research, and that's key, right? Because we need these innovations to really help us break through and facilitate this additional progress that we hope to make over time. Just a couple of other points too. Dr. Tedros also talked about how TB connects to two important narratives that we're hearing a lot of in recent years, and also that we're going to be tracking over the next year. So one is global health security. I mean, we're in it, right? We're in it now. I still got my mask on. But TB is an important piece of that, and I think a lot of the advocates, thankfully, have talked about the linkages between TB and this mantra around health security, but also the link and important connection between TB and health systems, or UHC, as Tedros said. And you'll find going into next year, right, that we're going to not just have a high-level meeting on TB, but we're going to have high-level meetings across these other areas. And so the question I tend to ask myself, and for people who know me, you know that I came from the advocacy community, is how we connect these dots, right? How we tell this story across those really important work streams, so that, we don't find ourselves kind of trying to move between disparate silos, but rather we're messaging this so that it makes sense to the broader global community, right? And so that we can mobilize the resources that are required, we can grow or sustain the momentum we need to truly reach the finish line. The last thing I'll offer, relatedly, is a question of, or maybe even a call to action as to how this all connects to the Sustainable Development Goals. I mean, coming into UNGA and maybe for the first time not hearing as much about the SDGs is a little disheartening. I'm glad it was raised today and it's coming up in conversations, but and thank you, Honorable Minister, for really sort of saying, look, we still have these 2030 goals that we need to hit. 2015 was a big moment, and I think, up until COVID, we talked a lot about it, and we've been distracted, understandably, over the past few years, but it's time to get back on track. It's time to remember that we set these goals for a reason, and they're not just goals, right? It's an opportunity for us to link these important issues like TB to other critical human development priorities. So we talk about equity, we talk about poverty, we talk about the people who are really being left behind. And I'm sure we are TB and people like Jackie can tell us even more. We meet them every day, we read these stories, we see them. Let's bring them back to what it is we're doing. Let's remember that we're not just trying to end disease, but we're trying to save lives. Thank you.
Thank you so much, Ms. Bass, for connecting all the dots, bringing us back to the SDGs and the fact that indeed we cannot end TB just by looking at TB alone, but looking at all of those multisectoral elements. And we're also very appreciative of the support of the US government across TB, across health, and of course also especially on TB research, as we are looking at bending the curve and going to the next level. Thank you. I'm now pleased to invite from Japan, which is a country which was our co-facilitator for the 2018 UN high-level meeting on TB, Mr. Eiji Hinoshita, Assistant Minister for Global Health and Welfare. Japan has been leading efforts on universal health coverage. In fact, Japan is one of the success stories in driving down the TB epidemic successfully, and has supported in placing a spotlight on TB in front of heads of states at the high-level meeting. So we're very grateful for your support, and thank you for being here, Mr. Hinoshita.